Welcome to Indian Anatomist. FMGE, NEET, Next 2024, PG exclusive test series. Today we are going to talk about a MCQ question from General Anatomy. Which part of long bone is typically characterized by a rich blood supply? The options are A. Diaphysis, B. Metaphysis, C. Epiphysis, and D is all of the above. Since the inquiry was concerning about the long bones, which possess some characteristics that are their own. It is now time to discuss the long bones, so let's get started. Because each of the long bones is solid and substantial, the human body is able to move around without restriction. The following components make up every long bone in the body are epiphysis, diaphysis, metaphysis, and epiphyseal plate. What are long bones? Long bones are cylindrical and longer than the other types of bones. These kinds of bones are found in the limbs or extremities. These bones act like levers and help us to move by working with different muscles. Examples for long bones are humerus, radius, ulna, femur, tibia, and fibula. Apart from long bones, what other type of bones are seen in relation to size and shape? Short long bones or miniature of long bones. They consist only one epiphysis instead two. Another variety is short bones. They are short, appears as pyramidal shaped, boat shaped, cube shaped, trapezium and pea shaped. Here is the irregular bones because they don't have proper shape. At last, here the patella is shown, which belongs to sesamoid bone. This bone is not a true bone that develops from tendon of a muscle. So no periosteum. I will put separate video for classification of bones. Now, coming back to today's MCQ. Because each of the long bones are solid and substantial, the human body is able to move around without restriction. The following components that make up every long bone in the body are epiphysis, diaphysis, metaphysis, and epiphyseal plate. The human body's long bones are all arranged in a vertical orientation, with the exception of the clavicle, also known as the collar bone, which is laid out in a horizontal orientation. Now, what is epiphysis? The epiphysis, also known as ends, it is always two in number for each long bones, that is, upper or proximal end, and lower or distal end. Each epiphysis ossifies from more than one secondary ossification centers. The diaphysis, also known as shaft of a long bone. It ossifies from single primary ossification center, except clavicle, which has two primary ossification centers for its shaft. The shaft consists of outer compact bone with central medullary cavity or canal that is filled with bone marrow. In adults, red bone marrow is replaced by the yellow bone marrow. Now, what is metaphysis? The extreme ends of diaphysis, or shaft, are called metaphysis, which meets at the epiphysis. It is the zone of active growth. What is epiphyseal plate? The epiphyseal plate is present in children and adolescents before the ossification of long bone. In adults, growth ceases, and the plate is replaced by an epiphyseal line. The epiphyseal plate, or growth plate, or simply physis, is a hyaline cartilage plate that joins the metaphyses and epiphyses of a long bone. This is the site where the new bone remodeling occurs. Girls' epiphysis, epiphyseal plate, and metaphysis usually fuse at 12 to 14 years old, and boys at 14 to 17 years old. The picture, displaying the X-radiograph of knee joint of a young children, showing a gap present between the metaphysis and epiphysis. This gap is occupied by the epiphyseal plate, made of hyaline cartilage, which is radiotranslucent, so appears black in color. Can an X-ray confuse a growth plate for a fracture? An ossified bone growth plate in a young children can imitate a fracture. Towards left side, X-radiograph image, showing the unossified shaft, with separate metaphysis and epiphysis. Black color gap representing the epiphyseal plate. At the same time on right side, in adults, the metaphysis and epiphysis are completely fused, and the epiphyseal plate is replaced by epiphyseal line, remnant of growth plate. At this point, you all know about the parts of the long bones. Long bones are important for humans because number 1, it works with ligaments and muscles to move the upper and lower limbs. Now, all three work as levers to lift the weight and move faster. Number 2, it stores calcium, phosphorus, magnesium, and salt, all of which are needed for the body to work. 3, hematopoietic, meaning that it makes red blood cells, white blood cells, and platelets from the bone marrow. What else is there to discuss with relation to long bone now? Yes, just a quarter of the question has been answered at this point. Those that are still present are going to answer the question, which will then disclose the best choice. How do long bones get their blood? Blood supply of the long bone accounts for 5 to 10% of the cardiac output. A typical long bone receives blood supply from various sources. They are the nutrient, epiphyseal, metaphyseal, and periosteal arteries. The nutrient artery supplies directly from major systemic arteries, present adjacent to it. Nutrient artery is a high-pressure system that comes from the systemic artery, closer to the shaft. It enters into the marrow canal of the long bone, through the nutrient foramen. In the canal, it splits into two, that go up and down, and get closer to metaphyses. As these branches move up and down, they give off small parallel arteries called radial branches. These radial branches bring blood to the bone marrow, and inner two-thirds of the diaphysis. Both the ascending and descending branches meet at the metaphysis. From there, they split into smaller spiral branches that connect to the metaphyseal and epiphyseal arteries. Periosteal arteries are low-pressure system that abundantly situated deep to the attachments of the skeletal muscles and ligaments. They branch out beneath the periosteum, which is the covering of the bone, and are connected to the Haversian and Volkmann canals of the Haversian system, a microscopic system. The periosteal branches are responsible for supplying the outer one-third of the shaft of long bones. In adults, particularly in short long bones, the periosteal vessels are responsible for providing the blood to majority of the bone, rather than the nutrient vessels. This is a schematic picture, showing the pathway of periosteal artery. It enters into the compact part of long bone, through horizontal perforating, Volkmann's canal, and vertical, Haversian canal. Through this, the blood perfusion occurs in outer one-third of the shaft. The metaphyseal arteries also originate from the adjacent systemic vessels, and directly enter into the metaphysis. It provides additional support to the metaphyseal branches of the nutrient artery, through their ascending and descending branches. These arteries anastomose with the spiral arteries, making the most vascular area of the long bone. After epiphyseal fusion with metaphyses and metaphyseal plate, makes an great vascular anastomosis. Now coming to the epiphyseal artery. The non-articular region of the epiphysis in long bone is the source of the epiphyseal arteries, which themselves originate from periarticular vascular arcades or circulus vasculosus. These non-articular surfaces have many vascular foramina, although only a small number admit arteries, that is, epiphyseal and metaphyseal. The rest serve as venous outlets. It is possible that the relative vascularity of the two ends of a long bone can be inferred from the number and size of these foramina. This is the area indicating the anastomosis of all the arteries, that is epiphyseal, metaphyseal, periosteal, and nutrient arteries. This type seen in adult long bones after the completion of ossification. Because of this anastomosis, the bone ends establishes the collateral circulation, that is the power of anastomosis. At the same time, in children's, before ossification completes, the blood vessels are separately supplying the independent area of long bone, and no anastomosis occurs. Because of this, during any lesion of the particular end of long bone, leads to avascular necrosis of long bones, or short long bones. Dear medical aspirants, the best option for given question is, yes, you are genius. The correct option is B, that is, metaphysis. Thanks for watching. We will meet you again, in good question. Please, like, share and comment. All the very best. Good day.